So in this video essay, I will be exploring what is co-production in art therapy and some of the current issues. Art therapy is by nature a collaboration between therapist and client. It therefore has much to offer to a co-productive relationship. The East London Foundation Trust within the NHS, where I work on placement, describes co-production as having historical roots in civil rights and social care in the USA, and in the UK, co-production in healthcare and social services has gone beyond models of service user consultations and towards developing a model of service delivery intended to impact the service user on a wider scale. So collaborative co-production requires service users to be experts in their own circumstance and experience and capable of making decisions, while professionals must move from being fixers to facilitators. To be truly transformative, co-production in art therapy requires a relocation of power towards the service user. So that this necessitates new relationships with frontline professionals in art therapy and the clients we work with, who both need training and to be empowered to take on these new roles. So service users' centeredness describes the relationship between therapist and client as a meeting of two experts, each with their own respective knowledge and skills. So there has been far more emphasis recently on research and practice on elaborating the clinician's skills in co-productive consultations. So they're, the art therapist in this case, rather than the skills of the service users. So this is where we need more forward thinking, especially as upcoming newly qualified art therapists. And I had an interview with Springham, who is a leading consultant art therapist in the NHS, who really has an expert insight into co-production and the psychological therapies as well as patient experience. I asked him what he feels are some of the current issues around co-production, and here's what he said.
What I would say about co-production is it's not that we should be justifying it for the health service or for any sort of therapy services. It's more just to notice that it's the most bizarre thing in the world that we don't have it, because it's more like a kind of religion, where there's only places like that where it's only what the priest tells you. You have to just take it. There isn't this interaction. So I'm increasingly seeing a lack of co-production in therapies, health, all health, not just mental health, as really, really absurd. And of course, why does the world do it? And the world does it because it works, because, these things are always a negotiation, and actually no one perspective holds the whole truth. So the cost to the intervention is just so vast when you don't include co-production.
So how can we facilitate service users' voices being heard? So Mind, a mental health charity in England and Wales, offers information and advice to people with mental health problems and lobbies government and local authorities on their behalf. They're also big supporters of the arts therapies intervention. And Mind, I came across a video that I think really reflects giving service users a voice, particularly when working in adult mental health. So here's a video where they describe their diagnosis in their own words.
I was about 16 when I was diagnosed with depression. My doctors think that it stemmed from my parents divorcing and struggling with school, really.
It all started when my father died when I was at high school.
It all started in university during my final year.
It all started when I was 16. I came out of a relationship I was in at the time, and I started purging and self-harming.
I first realised I had a mental health problem when I was 15. I was cutting myself every day and crying all the time.
Soon after the attack happened, I started to feel throes of anxiety, panic attacks started creeping in.
I first realised that I had a problem when I really wanted to stop all the things I was doing, but I just couldn't seem to stop no matter how badly I wanted to.
I was suffering from hallucinations, which at the time were really scary because I didn't know what was reality and what was my imagination.
At my worst, I felt like I was absolutely worthless, alienating and destructive, with no help of recovery.
I felt like I had this black cloud hanging constantly over my head, and it's just a feeling that stays with you and you can't seem to get away from it at all, and you feel completely alone.
I felt like this was going to be it forever.
I felt as though I'd never reach any of my ambitions or my goals.
I felt like I was in my own bubble, hearing muffled voices of people around me.
When I had my first proper mental breakdown, and I decided to run away from home.
I felt like the world would be better off without me.
My mental health problem means that I go through many highs and lows which I struggle to control.
Sometimes I just want to hide away.
I feel that I have to make everyone else happy, and every day is a struggle.
So under the guidelines from the National Institute of Health and Care Excellence, also known as NICE, they recommend that the arts therapies are considered for everyone who has psychosis and schizophrenia, which is the setting in which I work within the NHS, which includes relating conditions such as schizoaffective disorder. So when thinking a bit further around some of the people that we might work with, in adult mental health, particularly within the NHS, one has to consider psychoeducation when thinking about co-production. So within the interview with Neil Springham, I asked him what was the importance of psychoeducation, and here's what he said.
But psychoeducation, when it's good, I think levels the playing fields and equalises participation. So my model is knowledge about the brain, about attachment, about distress, about fight flight, all these kind of things is general. I think that doesn't belong to anyone. That, people do these studies and it belongs to humanity. So number one, I love seeing patients get hold of the evidence themselves rather than delegating that, because I've seen what it does. Two, I think it then, if you do it right, allows them to participate in co-production, because you've built a shared ground around which you can, is no one person's space, you can both take part. And of course the best psychoeducation is co-produced, where you co-produce it with people who've been through services, and then you're winning on every front, and we are. I mean, the results that we're seeing from this stuff are just stupendous. So an example of that would be that we had a patient who has explosive violent outbursts, and she really beats her boyfriend up really badly, or she just attacks people, and then she wants to kill herself because she feels so guilty afterwards. And she has been thinking that she is just a bad person for 35 years, and just the other week she started to say, well, this happened, and I started to realise I went full lizard brain on my boyfriend, and because I noticed it, I was able to pull back, and it's like, job done. Absolutely job done. She's now reframed herself in line with proper evidence and starting to see that she's dealing with an overactive fight-flight mechanism and all the stuff. And I just thought, this is already creating change. It's not just she's done the academics. It's more that this really, really changes behaviour and the experience of yourself, So, yeah, I feel stronger and stronger about it the longer I go on.
So within the guidance, planning and policy development within East London and the City Mental Health Trust, they believe that the service users and informal carers have a lot to contribute to mental health services through their experience of severe mental health illness and mental health services, personally or in a caring role. So they are expertise and have expertise that are not available from any other source. Therefore, service users and informal carers should be involved in planning services, running services, training and education and recruitment of mental health staff, and quality issues such as setting and monitoring standards across agencies providing services for people with mental health illness. So planning services and policy development, service users and informal carers should be involved as equal partners with professionals in planning and reviewing mental health services. And this includes running the services they use, including devising local policies, in quality issues such as setting quality standards, monitoring and evaluating services, in creating local charters, in the recruitment and development of staff, in the delivery and evaluation of educational and training programs for staff, including managers of agencies providing services for people with mental illness, in contributing to the development of local and national policies and procedures, and as members of local boards and committees such as the Trust Board, the Healthcare Government Committee, Local Governance Committees, Psychological Therapies Management Committee, and the CMHT and ward business meetings, and more than this as well. So this is in part some of the policies and guidance that the East London and City Mental Health Trust has when thinking about the involvement of service users within the NHS. So I think at the end of this video, the biggest thing I wanted to get across was the importance of co-production and bringing it into art therapy, not just in the NHS but everywhere we work, and particularly as we are new qualified art therapists, we can really be at the forefront of co-production and push it forward.